Hi, I'm Dr. Nguyen here at Nguyen Dental Practice. We get a lot of questions about dentures. So today, I'm going to answer some of the most common questions on this topic to give you a better understanding of dentures. Dentures are some prosthesis, something to replace the missing tooth that you have in your mouth. It could be made of plastic, it could be made of metal, porcelain, depends on what kind of dentures. Usually when you're talking about dentures, it means that you're missing some tooth. So if you got some tooth that cannot be saved, cannot be restored, you need to take it out, you may have to see an oral surgeon to take it out. And after the healing period, you can see a regular dentist or you can see a prosthodontist who specialize in dentures to have it made for you. Denture is the last resort. It's just like if you got problem with your foot, you rather save your foot instead of chopping it off and make a prosthesis, a false leg or something. So denture in a way is like a false leg for you. We don't recommend denture unless it is the last resort. If we can save the tooth, we will save the tooth either by root canal, by crown, by other option to save the tooth in order to avoid denture. But sometimes, because of the cost involved, patients just prefer extraction. And once you're missing the tooth, you have to replace it. The only option there is denture because the other option, implant, is very, very expensive. In general, there are two types. One is complete denture, where you replace all missing teeth in an arch, or a partial denture where you replace just some of the missing teeth in the arch. And there's two ways to replace it. One is fixed, which means you don't move it, it's cemented in there. If you just like a real tooth, you don't have to take it out every night. There's fixed denture. And there is removable denture, where you have an option of put it in and take it out as many times as you want. And usually when you sleep with removable denture, you should take it out. With complete denture, before is make up acrylic base with porcelain teeth or acrylic teeth. It could be made of titanium metal with zirconia crowns, or it could make up acrylic and porcelain teeth. You have to learn to adapt to the new denture, the new prosthesis. Sometimes it takes you weeks or months to get used and speak normally like before. You can't expect your denture to be just like your real teeth. It will help you in your chewing capability, but it's not as strong as your real teeth, but it will help you. Denture should last 5 years, but that's a function of how good you are in maintaining the denture, your eating habit. You see the dentist regularly to correct any issue that we have. Denture could last 5, 7, 10, 15 years or more. But if you abuse your denture, I would say it won't last too long. After extraction, usually you have to wait at least 6 to 8 weeks for the soft tissue and the bone to heal before we can start making the denture for you, either partial or complete. And after you have the denture, usually it takes weeks or months to get used to it. Some insurance will help pay for part of the dentures, and denture costs can range from 1,000 complete denture, 1,500, 1,600, to all on 4, we're talking about 15,000, 20,000 per arch. So it's varied, and we got some other third-party options that can help. If you're thinking of a denture, you should schedule your appointment the sooner the better, because the whole process takes a long time from start to finish. You cannot expect to have denture tomorrow to go to the wedding if you come into my office today and ask for one. Especially your case involves extraction. It takes at least 3 or 4 months.